Hello and welcome back to All Things Money. I'm your host, David Blain. During last segment, we were talking about Obamacare and healthcare reform and what it means for you in 2013. If you missed that segment, head on over to our website, which is www.dlblain.com, and there you'll find an archived copy of the show. I want to move on here in this final segment of today's show, and we're going to talk about some things that are coming in 2014, but I wanted to kind of recap a few things that are already in effect in case you missed it, make you aware of that. And if we have time, we'll get into what's happening in 2014. So things that have happened already. Number one is closing Medicare's coverage gap. Out-of-pocket expenses are dropping for those with Part D prescription drug expenses. And so they're working on that donut hole Medicare coverage gap for prescriptions. There's a small business tax credit up to 35% for health insurance. I will say that this tax credit, the cost to comply with it and get your CPA to actually be able to figure it out are tremendous. And what we've been hearing from business owners is it's not even worth bothering, because if you don't do it yourself, it costs more for the CPAs to figure it out than it's worth in some cases. Anyway, number three, a break for early retirees covered by the retirement plan. They can pay reimbursement for some of the costs to retirees age 55 who have not yet reached 65. The first step to help covering people with pre-existing conditions, the insurance pools have been created. There's a website called healthcare.gov that explains it. I will say once again, this millions of people without coverage, it's just not happening. There's very few people that have actually applied for and received coverage for pre-existing conditions through this new government exchange. It's been really a bust. Don't forget the 10% tax on indoor tanning that was enacted. No more lifetime limits on insurers. You can't impose a limit. That used to be that the insurer, some policies had unlimited benefits, and then others were capped at $2 million, $5 million. They can't do that anymore. There are new restrictions on canceling coverage. For example, if an employer makes an honest mistake on your application, they can't cancel your coverage. We've got the extended coverage for adult children up to the 26th birthday. This has been pretty popular, especially with the economy the way it's been. Kids are wanting to stay on their parents' policy. Guaranteed coverage for children younger than 19 with pre-existing conditions. They have to be covered. Preventative care without deductibles or co-payments for private plans. They have to provide preventative care. Medicare preventative care changes. Medicare beneficiaries are no longer charged co-payments. New restrictions on HSAs and FSAs. You can't use tax-free withdrawals to purchase over-the-counter medications. Stiffer penalty for non-qualified withdrawals from HSAs goes up to 20%. And Medicare Advantage plans face budget cuts over the next several years, which is a shame. I think people that I've talked to that had the Medicare Advantage thought it was good. It's kind of a privatization of Medicare where people deal with a private insurer instead of Medicare directly, and it's been very popular with a lot of seniors. So of course they're going to cut that program since it was popular. That's sarcasm, by the way. Okay. We've got a couple minutes left here. Let's go ahead and peer into the future here and look at 2014. There's a number of changes that are coming down the road for Obamacare 2014. Number one being in 2014, insurance will be universally available. Health insurers will not be allowed to turn down applicants because of their medical history. And I understand why they're doing that, but in effect that will you've taken all the discretion away from insurers, and there's no point in it. Whenever you make something mandatory, you drive the cost as a check and balance against it as we see today in medical care. Since they can't refuse to treat people showing up at the hospital, you see medical cares spiraling. Medicaid eligibility is expanding to include people under 65 with less than 133% of the eligibility. So some expansion of Medicaid eligibility. Federal help with premium for people with taxable income at a certain percent of the poverty level will receive health insurance premium tax credits. Insurance becomes mandatory. This is the big one. If you can't afford it, and don't buy it, you will get a penalty for not buying it. This is the big, constitutional thing. Can the government force you to buy a product? I think it's personally a travesty that this ruling to force people to buy something. New price rules. Health insurers won't be able to charge a higher premium because of an unfavorable medical history or a lower one if you're healthy. That's absolutely ridiculous. I mean, that's the fundamental nature of paying for something based on the medical costs that you're going to incur. It's absolutely ridiculous. It's like saying that all cars should be priced the same, or a house. Hey, it doesn't matter if it's 10,000 square feet or 800, it should be, the same price. It's ridiculous. Insurance, shopping centers, each state will offer an online exchange. And, of course, the big change for business owners, employers of 50 or more full-time employees who don't offer health insurance will pay a penalty. Once again, government forcing people to do things that they may or may not want to do. So these are some of the changes coming in 2014. You probably noticed I'm against this. It's a very draconian plan. We do have health insurance problems in the country, but the solution is not having the federal government mandate things to everybody. A country like Sweden or whatever that people always compare it to with 3 million people, it's not the same as 300 million people trying to be run out of Washington. Anyway, a lot of information there, a lot of changes coming down the pike. If you missed it, get in touch with us. Head over to our website, dlblain.com, and we'll give you a summary of what's coming. Okay, well, that's all the time we have for today's show. I hope you enjoyed it. Our little article about the stock jobbers, as well as our commentary on the health care reform. So for All Things Money, I'm your host, David Blain, and we hope to see you again next week, the same time and the same channel.
The proceeding was a paid program. The opinions expressed are not necessarily those of WNBU and Inner Banks Media.